Take a look at Senator Jeff Merkley, Democrat of Oregon, somehow using a Rubik's Cube to explain health care.
We need to do three things to put our healthcare system back on track. Make insurance work better for those who have it, extend health care to those who don't, and get control of those runaway costs.
The bizarre thing about this is that he went on for like 3 more minutes trying to finish this Rubik's Cube on camera, so if you have a sense of where healthcare is. But our man on Capitol Hill joins us now, Jonathan Karl from up on the Hill right now. And John, give us a sense of what the Baucus scoring has meant. It seems like a little boost of momentum for healthcare reform.
Oh, it's definitely a boost of momentum, but we are a long way from the end game here. I mean, this could have been a disaster. There were fears that this Congressional Budget Office could have come back with an estimate that this cost $1 trillion, and they would have had to go back to the drawing board and make it less expensive. But this comes in right in the sweet spot, under $900 billion. Like you said, in the rest of the world, that sounds like real money, but it sounds like a bargain in this context. So they're ready to go to the next step.
John, can you try to explain for a moment how important is Olympia Snowe right now? Is she still the single most important senator on this?
She is. I mean, she really is, because they do have 60 Democrats. They could do it all with Democrats. But you've got some Democrats that are really playing hardball on this. I mean, one that comes to mind is Senator Ben Nelson of Nebraska, who says, there's been talk about how we are in the 9th inning on this, we need to get started. He says we're in the first quarter. He uses a different sport, but he says we're a long way away. And the feeling from Nelson is that he is very uncomfortable with the idea of passing a bill that only has Democratic support, so that getting Olympia Snowe's support might be essential to getting all 60 Democrats.
And what is she looking for now that she has a score?
She's looking, first of all, she wants time. You hear a lot out of Olympia Snowe. She wants time to look at this thing and really analyze it. But she's raised some of the concerns about affordability and cost. She doesn't like this idea of taxing high-end insurance plans, for instance, another concern that of course, a lot of liberal Democrats in the House have. So she's got a whole range of concerns. It doesn't come down to one thing we can say we can get Olympia if we just do this.
Oh, they would have done it already if they knew that, John. What's going on in the House? Why can't they? They've been talking about it for several weeks now. When the finishing touches, whatever sports analogy you want to use, fourth quarter, late in the game, whatever it is, but there's still nothing. There's still not a draft of the bill that's presented to House Democrats.
Two things that are going on in the House. One is simply they really actually aren't in a rush in the House because House leaders don't want to vote on this before the Senate acts, or at least until it's clear that the Senate will act. So there is that going. They don't want to have to take a tough vote if it looks like something is going to get bogged down or not pass in the Senate. So they really aren't in that much of a hurry over here. But the other thing is that Speaker Pelosi has a problem with blue dog Democrats who are simply concerned that this bill costs too much. If you look at the bills that passed the 3 committees in the House, they're all over $1 trillion. They've got to bring the costs down to get the blue dogs on board, and it's a tough process.
Very quickly, Jonathan, in our last 40 seconds here, I just want to turn the topic to Afghanistan. We were just talking with Jonathan Martin. What is your sense up there about how much Democrats are going to give the president sort of a pass on this, support whatever he does, and how much they're going to sort of give him some trouble here on his Afghanistan policy?
Well, clearly it depends on what the president does, but if the president accepts McChrystal's recommendations, goes for an extra 40,000 or so troops to Afghanistan, there will be big problems from the Democrats in the caucus. You already have very influential voices saying that's a bad idea. People like Carl Levin in the Senate, Russ Feingold, but even the Speaker of the House. So there'll be big problems if he goes in that direction.
And I love this, John. We just got word from our colleague Zach Wolf up on the Hill. Roland Burris just on the House floor. I will not vote for any bill that does not include a public option. Oh, wouldn't it be great if Roland Burris is the key vote?
He could be the key player in all this.
He kills it all. I love it. Jonathan Karl joining us from the Hill. Thanks for being with us, and thanks for staying on it.
Thanks.
Thanks so much, John. Always good to have you. That does it for this edition of Top Line. I can't get Roland Burris as the single guy who may hold this up out of my head.
We love that.
Be sure to click us on again tomorrow.
And Joe Sestak fans, be warned, we will get him on at some point. Once again, he was a late scratch today. That's 2 in a row where we are keeping score, but we'll get him on again soon. You keep
but
the
we
conversation.
Might have Spectre on first now.
That's right.
Sestak,
There's your threat. It's twitter.com/TheNote. Keep the conversation going. And David, never in my life have I finished the Rubik's Cube. I tried.